Hello everyone, welcome back to Health Code Blueprint. Today I want to take a few minutes to break down the February 2026 OIG update on Medicare Advantage risk adjustment. We will cover what changed, why it matters, and how it affects the coding integrity and compliance in general. Before we continue, a quick disclosure. This presentation is intended for educational purposes only. It does not constitute legal, compliance, or coding advice. Always follow official ICD-10-CM guidelines and your organization policies when assigning diagnosis codes. Now let's get started. The Medicare Advantage payment structure creates a natural tension. And the reason is that because higher severity diagnoses lead to higher payments, there's always a risk of upcoding. So the OIG focuses on making sure diagnosis truly reflects clinical reality. The OIG consistently flag three weak points. We have the in-home HRAs that generate diagnosis without follow-up care. Then we have the AI-driven EMR prompts that influence documentation and chart reviews that are only intended to add diagnosis codes. The biggest issue with the HRAs is when diagnoses are made in isolation. If the diagnosis code or the medical condition is not followed by treatment, doesn't contain management or the care plan, it becomes a compliance risk. And the solution is straightforward. We should only validate encounters with diagnoses that reflect active management and a clear clinical connection. AI prompts can help with documentation, but they should not control it. In today's world, we have learned the benefits of using AI for certain reasons. However, when a set of rules push high weight diagnosis, it looks like a score inflation. Provider judgment needs to remain independent, and every diagnosis documented in the medical record should follow ICD-10-CM and coding clinic guidance. A retrospective chart review should focus on data integrity, not revenue, and only adding diagnosis codes without reviewing for possible removals is a red flag. A compliant audit reviews both sides. It adds diagnoses that are supported by the documentation and it removes those that are not supported. If the documentation does not support the diagnosis code, it must be removed. That's best practice. Medicare risk adjustment organizations must certify that their data is accurate and complete. This means that they need to monitor continuously and verify acceptable data sources, expand audits when error rates increase, and stay aligned with coding clinic and ICD-10-CM coding guidance. In the end, Medicare Advantage compliance is about clinical truth. When documentation shows real patient care, coding integrity, and audit readiness will follow. Thank you so much for watching, and I hope I'll see you in our next video.